Imagine looking through an old-fashioned keyhole. It's not a very big space, is it? Can't fit much through there, probably, maybe a straw or a hairpin. You can definitely fit a key, though. But what about something bigger, like a pear? Well, you might not be able to get a pear to fit through a keyhole, but surgeons are utilizing a new surgical technique that allows them to perform complex surgeries, including, removing a pear-shaped gallbladder from a keyhole-sized incision in the abdomen. It's called laparoscopic surgery, and it's not only changing the way surgeons perform operations, it's also changing how patients look and feel after they're done.
Purpose of this interview is to describe and let you know the kind of minimally invasive procedures that we are now capable of doing with what's called a laparoscope or a small camera keyhole incision. We do many procedures today that years ago required large incisions, 6 inches, 8 inches, 10 inches, even 3 or 4 inches, through tiny little keyhole incisions, centimeters in size and sometimes even millimeters in size. The exact same procedures can be done through these tiny little incisions very frequently. Not always, but very frequently.
Once the small incision is made, the surgeon inserts a trocar, which is basically a glorified straw, into the abdominal cavity. They place a camera through that tube, and through similar size or smaller incisions with similar trocars, they place operating instruments and do the procedure completely within the confines of the body cavity.
Virtually anybody is a candidate for a laparoscopic procedure that can have the procedure done open, although there are many notable exceptions based on individual circumstances and individual diseases, as well as individual medicines. The diseases today and the procedures today that we can do with this minimally invasive technique called laparoscopy are gallbladder procedures or cholecystectomies, stomach resections, pancreatic resections. We can cut scars in the abdomen that cause intestinal blockage. We can do liver resections. We can do bowel resections with laparoscopes also, such as colon cancers, small bowel tumors, and diverticulitis, which is an inflammatory condition of the colon, which is a very common indication for a laparoscopic procedure. We also can do many types of hernia repairs through the laparoscope, and these are all been successfully done for more than a decade, almost 2 decades now.
Medically, there are a lot of advantages. There's reduced hemorrhaging, which reduces the likelihood of needing a blood transfusion, and there's less postoperative scarring. And since we're going into the body rather than opening it up, there's reduced exposure of the internal organs and a reduced risk of infection. Then there are the benefits the patients feel.
What the surgeons hope to do and what we hope to do is we hope to be able to do your procedure with a laparoscope, with a minimally invasive technique. And if we can, you can expect the same results as it would have been with an open procedure, but with less of a scar, less hospitalization, and less pain with your recuperation. For gallbladders, it was a day, 2 days, 3 days for the open procedures. For the laparoscopic, most of the time we send the patients home the same day, sometimes the next morning if it's a late case in the day. There are some laparoscopic procedures which require hospitalization for a few days afterwards. The incisions are bigger, the procedure is more complex, we need to keep an eye on you in a hospital bed for your recovery period. But invariably, the recovery is easier and the recovery is shorter.
After the procedure, the surgeon always checks up on the patient to make sure the wounds are healing okay and the patient is doing well. Immediately afterwards, the patient should take it a little easy. No lifting anything heavier than 10 pounds for 6 weeks, for example. But with less pain and less scar tissue, they are encouraged to walk and resume easy daily activities. Sure beats hanging out in a hospital for weeks. I'm Dr. Mike Rosen, and you're watching the eHealth Network. Stay healthy.